Oh, she shared my post. That's really sweet of her. Is there anything I can do to go into active labor? Guys, I've read so many studies about active labor and how to go into it. There really is not anything you can do to make yourself go into labor. And it's a real bummer. I just saw a post today talking about how, okay, Facebook, you just need a little wipey off over there. Is that any better? Sorry, guys. I just saw a post today about how sex will make you go into labor. And it doesn't, like the studies don't show that it puts you into labor, which is a real bummer because everybody says it, everybody thinks it. So there you go. There really isn't much you can do. I mean, you can have the dates ahead of time. You can try castor oil, but I really don't recommend castor oil. And I also, if you are going to do castor oil, you need to do it in conjunction with your provider and ask them how they feel about it and make sure that they know. So there you go. I wish that I would have just eaten more frozen yogurt, propped my legs up, and done the very least possible as a human being until that baby came out. I was 12 days overdue with my last baby, so I get it. Do you recommend someone with scoliosis get an epidural for the second time around? Did you get one the first time? Usually people don't have a scoliosis where they're placing the epidural, but that is above my pay grade. Anesthesia has to answer a question like that. Ask your provider if they don't know. A lot of times they can get you a consult either over the phone or something like that with an anesthesiologist to give you some more information. I stopped taking my, since I found I was pregnant, my prime care thinks I should. I do not know much about that. Is baby dropping a big deal? Usually it happens towards the end, but it can happen early on. Some people have a very low baby. Goodbye, bladder. Poor bladder. Yeah. So it's not really a big deal, but it does show the baby's probably coming in the next month. I'm 23 weeks, but I'm not gaining weight. What should I do? Often, in that second trimester, you don't gain a ton of weight. So I don't know. In Leana on Instagram said, hello. Welcome, everybody. Real quick, in case we haven't met, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm the creator of the online prenatal class for couples, which is the easy way to get prepared for birth. It goes from pregnancy, third trimester testing, labor, especially laboring at home, laboring in the hospital, epidural, C-section, induction, natural pain management. It's going to cover all of that. What happens at delivery, what happens right after delivery, and then your postpartum stay and your first months at home. So it really covers everything. You can even get my bundle and get a breastfeeding class as well. So if you guys have questions about my class, please ask them below. It is a virtual class. It's available 24/7. It starts at $89, but if you use code FASTERBIRTH, you can get 10% off tonight. Water broke during Foley placement. Took Cytotec. It's been no hours contractions. Third baby. Have you only taken one Cytotec? Because sometimes it takes a few Cytotecs to get things going. So I don't know. It's hard to say. Ask the people. I'm going to scroll all the way to the bottom because I know I've missed a bunch. If I missed your question, please go ahead and ask it again. I'm 37 weeks and 3 centimeters dilate, 80% of face since 35 weeks. How can I get labor started? You're still only 37 weeks. Like I said, there really isn't a whole lot of things you can do to get labor started. And I'm going to start right here with where the questions are. Is metformin safe during pregnancy to help manage sugar? Yeah, lots of people take it. And it's not unusual. Are laparoscopic myomectomy a long procedure? I do not know. That is outside of my scope. I would kind of guess not, but I honestly have no idea. I mean, define long, I guess. Is 4 weeks too early to take a test? So usually you can take your test when you would have missed your period. So if you've missed a period, you can take a test. I usually recommend taking it first thing in the morning because that's when the concentration of the HCG in your urine is highest. I've been eating so much junk food during my last trimester of pregnancy, and I've been feeling guilty. That's tricky. It's also probably not going to make you feel all that great, like health-wise either. So That's something to consider as well. You want to have a healthy rainbow filled diet. That doesn't mean you can't have a treat every once in a while. But there's also, there's no moral thing to eating things. So yeah, I'm still on birth control. Can I still get my fertility tested by a specialist? I'm not sure how hormone testing goes when you're on birth control. I've never had that. You can definitely talk with a provider. There isn't really a way to know that you're fertile per se. I mean, they can check to see your eggs, like yeah. Whew, we are getting some weird questions on the YouTube, so that's fun. Yeah. I read that it can cause birth defects and autism, but I think my OB is going to put me on it. So it's also called by glucophage, and lots of people are on it. I don't believe that it's anything has tied it to birth defects. They've talked for a while that Tylenol is tied to birth defect, like autism, but rare is the woman who has not taken a Tylenol in 9 months of pregnancy. So it's really hard to say that it can really be tied to something like that. So, hi, just found out today I'm pregnant for the first time. I've been trying for 5.5 years. Oh, that's so excited, Crib Kicker. Oh, I'm really excited for you. Congratulations. Can fibroids cause preterm labor? If so, what can be done to prevent this? I would just talk with your provider, see how big the fibroids are, any precautions you should have. I guess they could do like a check for cervical length mid-pregnancy. Yeah, there really isn't too much they can do. And I've heard lately that they really are not putting people even on like bed rest because they haven't found that it's super helpful. So, honestly, most people who already have kids also just can't be on bed rest. Yeah. I got a blood test done, but the test says positive abnormal. Should I be worried? I'm not sure what that would show. So call your provider and ask them. Had implantation bleeding when my cycle came. When should I test? Hard to know. If you missed a period, you can test your first urine first thing in the morning. 8 weeks pregnant. Congratulations, Katie. Every night I feel feverish and like I have the flu. Should I be concerned? It may just be that you're super tired. That first stage of pregnancy, you are just so tired. So I'm kind of guessing that that's what that is. Do you actually have a fever? I tend to kind of almost just feel that way when I'm so tired. Yeah. With my last baby, I was like, I either am pregnant or I have cancer because I was so tired. Yeah. And Crib Kicker says she's so tired all the time, feel cold and weak. Yeah. Plus, it's the time of year. Like, everybody's kind of chilly this time of night. All right. Any more questions? 20 weeks anatomy scan tomorrow. Is it normal to be nervous or worried? 100% normal to be worried. As a labor and delivery nurse, I am a basket case when I go in for my anatomy scan. I know a lot of people are excited to learn the gender. I was just looking for like chambers of the heart and brain and kidneys and all those different things. I was also excited to learn gender, but very normal to be nervous, and I hope things go well. Most often things go very well. Most scans come out just fine. Last call for questions. I just wanted to pop on for a little bit. My husband took my daughter to a church thing. Actually, I have a few more minutes. But in case we haven't met, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience. I also did pediatrics, hospice, geriatrics. I had a job once where I went to people's houses and I changed old men's catheters. That's the job I had before I went to labor and delivery. That's the job I had right after my first baby was born. So yeah, winning over here. Anyway, I'm also the creator of the online prenatal class for couples, the easy way to get prepared for birth. If you guys are looking to get prepared for birth, which I think everyone needs a prenatal class, it is the easiest, funnest, fastest way to get prepared from bump to bassinet. So if you have questions about it, please feel free to ask me in the comments. I do not know much about progesterone. Any tips for diabetic pregnant women? I got that too. So you're already diabetic before you got pregnant? Just keep close watch of the sugars, and try and follow the diet as well as you can, and also be kind to yourself, because it's just tricky. um People seem to blame themselves when the sugars aren't right, even when they're eating the diet, and there's not so much you can do. Like, that's why we have insulin, is because, that's what you need. So, oh goodness, currently went through eclampsia with Caesars 6 months ago. I'm currently pregnant again. Tips. Did you have, Yana, are you on aspirin? Have you talked with your provider? Hopefully you've talked with your provider about getting on aspirin. They've shown, and you might want to go on a high dose. I don't know. Oh goodness. They're losing it on the YouTube. Hold on, guys. Um anyway, now I can't remember what I was talking about, which is really shocking. Anyway, aspirin has been shown to help decrease chances of getting preeclampsia, make it less severe, make it show up later. So that's the main thing I would recommend. My son-in-law got a vasectomy. My daughter got pregnant again. What did they do wrong? God bless. I think you can figure that one out on your own. I'm 36 weeks pregnant. In the middle of my stomach hurts when I get up from my bed, the abdomen area. Yeah, a lot of times you might have a contraction when you get up. Um, I'm just having some good times here on Facebook. I obviously, or YouTube. I should stop. Okay, so Yana, not as yet. They talked to me about it being aspirin, but I'm on a strict diet as of now. So they recommend aspirin at 12 weeks of pregnancy. So keep talking to them about that. I'm not sure the diet has been shown to help preeclampsia, but that is just what I've read. Anything to prevent having a placenta abruption? No, not really. Unless they know that there was a reason why it happened. Like, did you have PIH? In which case they'd recommend aspirin. "40 weeks pregnant, so ready to give birth." I bet, Dulce, not sure how you say it, but good luck with everything. Kate said she had gestational hypertension. Oh, and you had the abruption. So high blood pressure you got to think it's like all this whooshing from the uterine side, and it can make your placenta abrupt. Prenatals that don't F up your stomach. I mean, you can try the liquid kind, you can try the gummy kind. It's really hard to say what works for everybody. You can try different kinds. Talk with your provider. They might have something. I always just took the tablets, so I'm not super helpful. I've had a retained placenta 2 out of 3 times. Is there a way to ask D&C afterwards without sounding crazy? No. I mean, I think that's valid to say, hey, can we just do a D&C to be sure? It's really not that hard to take you back to the OR and do it, unless they know that the placenta is intact. Because you sometimes can tell, okay, this placenta is intact. It's obviously nothing's left. But sometimes there is kind of a question mark, and we'll finish you up and just kind of keep an eye on it. So if there's any question at all, I think going back for a D&C is probably a great idea. But talk with your provider, talk with them early. Is it safe to have a natural delivery after having a fibroid removed a year ago? Did they cut into your uterus, I guess is the question. I've been hearing people talk about requesting that they wait to cut the cord after birth. Thoughts? Yes. So it is routine to wait 30 seconds to 2 minutes after birth to cut the cord. So that is routine. Talk with your provider, see what they normally do if you want to wait a little bit longer. I know a lot of people are like, I want to wait until it's completely white. But honestly, by 2 minutes, it's pretty much done. So, and the other annoying thing that a lot of people don't talk about is a lot of times your cord can only get baby to like right here. You can't like bring him up where you can see him good. So sometimes people find that annoying because sometimes literally the doctor just has to hold them for the 2 minutes because you can only get baby into a very awkward place on your abdomen. Obviously, we don't want to drop them. So, yeah. DJXO said yes, but the surgeon said it was not a deep cut. If you've had uterine surgery, it's something to ask your provider about. That does increase your chance of a uterine rupture. So it is something to talk with them about. Hopefully you have good notes about it. Oh, man. All right, last call for questions. In case we haven't met, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience. Thank you so much for joining me here tonight. If you enjoy pregnancy chats, you know you will love joining me in the online prenatal class for couples. It is the easy way to get prepared for birth. With this last call for questions, if you have any questions about my class, please ask it in the comments, but you can find it through the link in my profile. And tonight, if you use code FASTERBIRTH, you'll get 10% off. Yeah. Tablets and gummies, and it still kills your stomach. So there's nothing in it like aspirin and ibuprofen can actually hurt your stomach, like give you ulcers and stuff like that. There's nothing in a prenatal that should be doing that, but sometimes they can make you feel nauseated. Yeah. Can I see baby at an 8-week ultrasound? I think normally you'd be able to see the heartbeat at 8 weeks, but that is only if your dates are right. Yeah. DJXO, yeah, it scares me, but so does a C-section LO first baby. Yeah, so it depends on how they did the surgery with the myomectomy, if they went up and down on the uterus or side to side. And then, yeah. Amanda said heartburn that I feel in my ears help. So your ears are so close to your throat that if you have burning right in the upper area of your esophagus, you can sort of feel it in your ears. Tums, if Tums aren't cutting it, ask your provider if there's something else you can take, like a over-the-counter tablet. Yeah, so upset your stomach. That makes sense. Yeah, a lot of people feel that way. I don't know. There's gummies, liquid, tablets. That's really all there is for them. All right. Thank you so much for joining me, you guys. We had a bunch of you here tonight. Feel free. Yeah, some people saying Pepcid. That's the word I was trying to think of. My OB has me starting weekly BPPs at 34 weeks. What's the purpose? Ask your provider. They say due to BMI over 40, so overweight. I wasn't sure. I wasn't aware that that is a reason for a BPP. But maybe it is. We actually go over BPPs, NSTs, and all those third trimester, the regular third trimester testing in the online prenatal class for couples. We talk about what to expect at the testing, how to interpret the results, and how to make decisions afterwards, because there's always a chance that the BPP will be off, and then you have to make the choice if it's time to be induced or wait or what you want to do. Yeah. So anyway,